So what we're going to talk about today is controlling of bleeding in a wound. So I kind of have a big mannequin here, and we're going to take the presumption that the bleed is on a femoral artery. So normally the first thing in a first aid course is direct pressure. So you take your dressing and you apply direct pressure to the wound. So it may take like really firm pressure down into the wound. If this doesn't work, generally the next stage is absent. So in a first aid course, the next stage is absent. If this doesn't work, well then we're in trouble, and no one should ever bleed to death from an external bleed on an extremity. So the alternative, we have two things. We have a tourniquet. I'm going to go over this with you in a second. But if I pull the tourniquet open, loop it over the leg, about 2 inches over the site, pull the cuff until it's tight, strap it in place, and then there's a windlass here that I begin to twist until I get firm pressure on the leg and the bleed stops. So nice and tight. Generally what happens is this is an extremely painful thing to put on, and people start to complain of the pain. Don't allow that to stop you from putting this on tight enough. And then you mark the time on the device, and you'd mark the time on the patient's forehead, because when you go in, the doctors and nurses will always look at your face. So when they see a T and the time of application of the tourniquet put on your forehead, then they know. Never cover this up so it's seen, and this goes on tight and tight and tight until the bleeding stops. There's going to be a lack of blood now into the extremity. There's the issue of compartment syndrome, there's the issue of necrosis of tissue, and there's the issue of nerve palsy. However, this generally doesn't take place permanently until after about 4 hours. So the application of this between 2 and 4 hours is generally okay. And the alternative to them three things is for you to bleed to death. And you'll bleed to death out of a femoral artery in about 3 minutes. So this has to be put on nice and quick. On top of this then, or in conjunction with this, there's also haemostatic dressings. So you take the haemostatic dressing out. Usually what I do is I just drop it over my shoulder here, and then I start to pack it into the wound all of the way in until I get in plenty of the packing right down as far as I can with my fingers, down to the bone. I'm eventually going to have all of this dressing packed right in, and when I have it packed in right to the top, I'll apply a dressing over the top of it, and then I will secure the whole lot in place with a bandage. So that's what that will look like then. It can be done reasonably quick, lots of pressure on here, and it can be done in conjunction with or before the application of a tourniquet. So if the direct pressure doesn't stop here, then internal direct pressure by applying the hemostatic dressing, and then if that doesn't stop, the tourniquet. Preferably, I prefer, if I don't get direct pressure and it stops within the first couple of seconds, I like to put a tourniquet on, because we don't have time to be messing around, and time is crucial when you're bleeding to death. Okay, thanks guys.